joined with a very special guest this morning, Dr. Todd Fincher. I'm running over my words. Dr. Fincher,
Right.
Welcome this morning.
Thanks,
you are with Greenwood Leflore's hospital. You are a dentist
Right.
in Greenwood and a surgeon.
Right.
Let me talk to you this morning. I know that there are a lot of people out there who, when you say dentist, I mean it is immediate anxiety and fear. Oftentimes when people come to see you and they are scared or whatever about sitting in a dentist chair, or possibly if they have to do some surgery, what do you do, or what do you always say to them to kind of ease their pain?
Well, it is high anxiety. That hasn't changed. People have, the dentistry is just anxious for a lot of people. We do our best to calm them. We've got several modes now to help people that maybe can't make that step to move forward or unable to make a step to move forward to have the dentistry done, anywhere from children's dentistry to patients that are handicapped in some form to anxious adults. So we've got several different modalities, and we can kind of go into those about where you get treated, how you get treated, what you need, a person that is good patient for treatment.
Now when a lot of times when people are, I think people get scared probably more so when they know they've got to come in to go up under,
Right.
anesthesia. What is it? What are types of procedures that people would have to come in for, and is it safe for them?
Oh, it's, sedation dentistry now is probably the safest modality to have work done because you're in a controlled environment. We, through Greenwood Leflore Hospital, put patients to sleep using general anesthesia, which is highly controlled. They've got a very well-qualified group of certified registered nurse anesthetists there. Mainly we use that for pediatric dentistry for children that are 2 years old or older that have some significant problems. They can't sit still in a dental office, So we put them to sleep. We do all their dentistry at once. They wake up, it's over, and it's a good, it's a good feeling. They haven't been hurt. Their dentistry is done, and they go about their normal life. For adults, hospitalization dentistry is probably not the best. We do in-office sedation for those patients. Again, it's highly monitored, highly regulated, everything checked off by the Mississippi State Board of Dental Examiners. And we use different agents to put those people to sleep with in the office. So
you actually do some of your work actually at the hospital?
Right. Mostly the pediatric cases, and that's where pediatric dentistry is really best done, is in a hospital setting. For adults, teenagers and adults, most of that is done in the office. And we do all kinds of dentistry, from regular fillings to dental implants, anything that can be done in dentistry can be done while the patient is sedated.
And typically when you talk about those that need to go under, what type of procedures are they looking at having?
Most of the time with the children, it's children that have a lot of decay in their mouth. We may be working on we may be working on 20 teeth at one time. We may be working on half of them. So it's children that for some reason can't take care of their mouths or did not take care of their mouths. Those are the ideal candidates for hospitalization dentistry. As for adults, it's just people that are anxious, people that don't want to feel anything or afraid of feeling something, or just can't get their mind around getting their dental work done. Then we use IV sedation in the dental office. Again, highly monitored, highly regulated, safe agents, and we can do virtually any type of dentistry.
It's amazing how far we've come technology-wise, and how safe it is. And it's really interesting to hear that you're doing things at the hospital as well as your office, because I know so much is done in office because it's so high of a very perfect environment for you guys to work in, right?
Correct.
Now let me ask this: as we're talking about sedation, as we're talking about coming to dentists, I know there's folks out there that say, I don't want to have to go to the dentist if I don't have to. Now, everybody obviously needs to go to dentists, but two questions. How often should people come and see their local dentist, and what can they do to maybe not have to have surgeries and whatnot?
I think you go back to the basic premise that dentistry has been built around, and that's just regular checkups, preventive dentistry, just like preventive medicine. See your dentist once, twice a year, get your checkups done, take care of the things before they become significant issues.
Make sure those pearly whites stay pearly white,
That's
right?
right.
Fantastic.
Right.
Dr. Fincher, thanks so much for being
great to
here.
see you. Thanks for having me.
And if folks want to get more information from you or Greenwood Leflore, how would they do that?
We've got a website that's up and running. Greenwood Leflore's got a website that's extensive with all of that. You can contact them or me.
Okay.
And
what's your website?
It's drtfincher.com.
Dr. Fincher. Well, if you got your dentist questions, you can ask Dr. Fincher or go to Greenwood Leflore's Hospital's website. Thanks so much this morning.
Good to see you.
Absolutely. Stay with us. We've got more coming up after our break. We'll be right back.
This Health Matters segment is brought to you by Greenwood Leflore Hospital.